Hello and welcome. Anovulation is a major cause of infertility. About 25% cases are of anovulation when we talk about female causes of infertility. Let us talk about the ovulatory disorders which cause anovulation. The first kind is when the hypothalamo-pituitary ovarian axis is disturbed right from the hypothalamus. उसको कहते हैं हाइपोगोनाडोट्रोफिक फेलियर. इसमें स्ट्रेस रिलेटेड डिसऑर्डर्स आते हैं. एग्जाम्पल इज एनोरेक्सिया नर्वोसा. द गोनाडोरिलिन्स और गोनाडोट्रोफिन रिलीजिंग हार्मोन्स आर नॉट secreted. On investigation you will find that gonadotrophins like FSH and LH are low. Serum estrogen is also low and gonadorelins are also low. Serum prolactin levels are always a part of investigation of infertility. They will be normal in this case. Then the other thing you need to make a diagnosis is you perform a progesterone challenge test for amenorrhea, which is present in these cases. So amenorrhea is obvious only because the effect of FSH, LH, estrogen is very important to cause that normal menstruation pattern, isn't it? So there is amenorrhea, and when you give a progesterone challenge test, now what is this? So if the endometrium is well set with the help of estrogen, you give progesterone for a period of 5 to 7 days and then you withdraw it. So on withdrawing there will be menstruation, and this is known as progesterone challenge test. It tells you if the endometrium has been under the effect of estrogen or not. So here it will be negative. Now how to manage? So management basically for anorexia nervosa, the first thing is try to help the lady to gain weight. That is very important. Leptins are also given to cause ovulation in such cases. Treatment with human menopausal gonadotrophin is carried out. Now the second category is hypogonadotrophic dysfunction. Here the main cause is anovulation. The cases of polycystic ovarian syndrome are included in this category. This you find out, conduct all the tests for ovulation. You will use ovulation induction agents. In those, one is clomiphene citrate. Clomiphene citrate is a chemical agent which blocks the estrogen receptors. तो जब सीरम में एस्ट्रोजन कम हो, receptors block हो गए and body is not able to identify, then feedback mechanism से gonadotropins का secretion pituitary से बढ़ जाता है. So FSH levels are raised and it causes ovulation induction. So clomiphene citrate is a well approved drug, and the chances of ovulation with clomiphene are about 80%. Chances of pregnancy are about 40%. So, but it causes multiple pregnancy in many cases, in about 5 to 10% of the cases. So that is one of the side effects of doing ovulation induction. Now the second drug is letrozole. Letrozole is an aromatase inhibitor, and it blocks the conversion of testosterone to estrogen. So this increases the FSH secretion by pituitary and causes this. So letrozole actually has been banned in India because of its teratogenic effects that have been detected lately. And the last drug is gonadotrophins. So human menopausal gonadotrophins are used. So from the urine of the menopausal ladies, because there is a high concentration of FSH and LH, this gonadotrophin is collected and it is used for ovulation induction. So this was about the ovulation inducing agents. And now let us talk about ovarian failure. So ovarian failure, premature ovarian failure is when the cessation of menstruation, it occurs before the age of 40 years. Then we say that usually कि premature ovarian failure हो गया है. तो कैसे पता लगाते हैं ovarian failure हो गया है? तो हम ovarian reserve के tests करते हैं. We try to find out the ovarian reserve. How many follicles are left? That is ovarian reserve. That is a separate topic. I will discuss it separately, so you try to find it out. But how are you going to treat it, and what are the causes behind premature ovarian failure? So the causes are, first, metabolic causes. Galactosemia. Galactosemia is a genetic disorder in which the galactose levels are raised in the blood and they cause toxic effects on the ovary. Second is iatrogenic. It can be due to chemoradiation or oophorectomy performed along with hysterectomy, or infections due to measles, mumps, rubella, or it can be autoimmune causes like polyglandular autoimmune diseases which affect the ovary, or it can be genetic like Turner syndrome. So these are the causes which lead to ovarian dysfunction and premature ovarian failure. So how to deal with it? So you will have to perform an IVF for these patients. But for IVF, either donor ovum, or what can be done is go for an ovarian reserve assessment, and if possible you can extract the ovum from the lady herself.